Good morning, everyone. I see the recording is on. Let me just do a quick count, make sure we have enough members so we can get started, and then I will call us to order. Okay, all right. I see that there are 6 members on, so we'll go ahead and get started. All right, so it is 11:01, and I'd like to call this meeting of the Assembly Committee on Housing and Homelessness to order. If we can go ahead and do a roll call, please.
Ms. Aller? Mr. Constant?
Here.
Mr. Dunbar?
Sorry, I couldn't get the unmute button. I'm here. Thank you.
Thank
Here.
you.
Kennedy?
Here.
Ms. LaFrance?
Here.
Mr. Perez-Verdia?
Here.
Mr. Peterson?
Present.
Ms. Quinn Davidson? Mr. Rivera?
Present.
Mr. Weddleton?
Here.
Ms. Zolotel?
Thank you. I guess I will just note for the record, Ms. Zolotel is in attendance, but not in her role as an assembly member, as I understand it, but in her role as the interim executive director of the Anchorage Coalition to End Homelessness, just to make sure that's clear on the record. Okay, so just briefly want to go over our agenda for today. So we have a few items under business to go over. First is a discussion on winter abatement. We're going to be talking about FEMA reimbursement as it relates to mass care, winter family overflow, and winter policy. And then that last item on there, overview of housing resources, current and future. Not quite ready to go over to do that particular discussion just yet. I'll probably postpone that to the February meeting. Instead, we're going to be going through a similar exercise that Ms. Allard led in the Community Economic Development Committee regarding goals and priorities for 2022 for that committee. I want to do something similar for this committee using the template that Claire Ross provided at the last Rules Committee meeting. Also want to note, when we get to the winter family overflow shelter issue on the agenda, the Coalition to End Homelessness is on top of talking about that subject, is also going to be doing their regular monthly update during that agenda item. So with that, we're going to go ahead and move on in our agenda to initial audience participation. And I actually do have one individual that signed up, Miss Dana Graham. If you are on the phone, Miss Graham, it's *6 to unmute yourself.
Good morning, this is Donna Graham.
Great, thank you, Miss Graham. You will have 3 minutes. Go ahead.
I'm
Oh, Miss Graham, I think you got muted.
My apologies.
I thank you.
Okay, go ahead.
At 15th and Cordova, there's a local organizing ministry at Central Lutheran Church that has been involved for years with sheltering families in cold weather. And of course, that was precluded because of pandemic. And we were delighted when the municipality managed an arrangement to have our families in hotels. My big concern and why I'm here today is that I understand that has come to an end, and I'm very puzzled how that happened. I thought it was quite successful from what I hear, that the Salvation Army was supervising and overseeing that program of families who are housed in hotels, a much better deal for them than church floors. And we thought it was going well, and now I understand that has ended, and I'm wondering what happened to that. Who was calling the shots on ending that? So I guess the question really goes to Ms. Zolotel with Anchorage Coalition to End Homelessness, but of course to Assembly too, because I don't know what happened, but I'm very concerned. We have a lot of winter left, and most of these guests are children. So that's why I'm here to speak. Thank you for listening.
Great, thank you, Ms. Graham. I think as I alluded to earlier, we are going to be talking about winter family overflow later on in the agenda, so hopefully we can address those questions at that time. But thank you for your participation.
Thank you.
Okay, so that was it. That's the, I don't have anyone else signed up for initial audience participation. So just as a reminder for members of the public, because I do see quite a list of phone numbers here, we will have a final audience participation at the end. Depending on how long the agenda takes, hopefully we will have a decent amount of time left for final audience participation. Okay, so let's go ahead and move on to our first item, which is discussion of winter abatement. So I'd like to get some clarity on what's going on with winter abatement and the policies that impact whether abatement is occurring or not. So I think the first question is the obvious one, which is, if members of the committee don't mind, I do have some questions to get this started, and then if folks want to get in the queue, please feel free to do so. So first question to the administration, and I do see that we have some folks from the administration here, so I want to thank you for attending today. So can the health department clarify on whether abatement is currently happening?
Mr. Chair, this is Amy Boston, Municipal Manager, and I want to be very clear. I'm the one that's representing the municipality, the administration in this meeting. Yes, winter abatement is happening on a limited basis. According to the Parks and Rec Department, who's actually doing the winter abatement, not the health department, the focus is on priority focuses on public safety. They have been working in Rush and Jack this week. Last week, they were working in Mountain View. And they do have plans in the near future to actually clear a couple of camps that are in South Anchorage.
Got it. Thank you. So then I guess my follow-up to that, and thank you for the clarity on your representation of the administration. So I guess my follow-up is, so as I understand it from, and this was many months ago, right? We weren't doing winter abatements because at the time because of shelter capacity. So can you just describe sort of what happened that allowed winter abatement to be turned on? I think, as you said, it like on a limited basis.
Yeah, there's capacity.
Specifically, where is their capacity?
There's shelter capacity. What I've been told is there's about 90 spots that have opened up. So they do have shelter capacity. And that's the information that I have for you.
Okay, thank you. So as I understand it, there was a sort of a policy change at the Sullivan to increase capacity from 420 individuals to 510 individuals. I believe the 510 is what's been showing up on the dashboard recently. Is that accurate? Is that where we're currently at with the Sullivan?
I can certainly get that information for you as I requested from you multiple times. If you had specific questions, I asked that you provided them ahead of time and you did not. So I'm happy to take all of the Assembly's questions and get back with you in writing.
Thank you. Appreciate that. Okay, so then I guess my last follow-up on that before I go to the queue, I just wanted to get a sense, if we do have increased capacity at the Sullivan from 420 to 510, just want to get a sense of sort of what does that look like in terms of the staffing ratio there? Are we operating at the same staff, even though we have 90 more individuals that are being sheltered at mass care in the Sullivan? And sort of what kind of impacts that may or may not be having at the Sullivan. Just wanted to dig into that. And I understand if you don't have responses for that at the moment.
No, I'm certainly happy to get back with you on that. But I will say if there's 90 available capacity, that doesn't mean there's 90 more people there. I do know that they have had great success in moving folks and navigating folks from the Sullivan to other locations. And that in part is why there's been additional capacity at the Sullivan. But I will get you, if members have specific questions, I'm happy to get you that information.
Great. Thank you. All right, so I'm going to go ahead and go to the queue now and just pause a second, see if there are any members who have questions on this topic.
Felix?
Yes, go ahead, Mr. Dunbar.
Sorry, I caught most of what Mr. Domboski said, but Mr. Domboski, could you restate going from 420 to 510? How exactly was that achieved? That is it relying on sort of reconfiguration of the Sullivan? Was there a portion of the Sullivan that we hadn't opened before, or is it? I assume it's not the Warmington. So how was that achieved?
Mr. Dunbar, I'm happy to get that information and get back with you in writing.
Okay. Thank
you. Okay. So I'm not seeing anyone else in the queue, and let me just go through my list. All right, yeah, I think that pretty much covers my list of questions. Okay, so then we'll go ahead and move on to the next topic, which is dealing with FEMA reimbursement. And just as an FYI, this is, I think as I told the administration already, this is likely going to be a regular monthly agenda item here at this committee. I know the body as a whole is very interested in keeping on top of FEMA reimbursement sort of generally. And for my part, I'd like this committee to keep tabs of this sort of sliver of that reimbursement, because I know members in this committee are particularly interested in that topic. So with that, I'm just wondering if someone can give sort of a general overview of where we are with FEMA reimbursement for mass care.
Mr. Rivera, again, this is a topic that we are actively seeking reimbursements every single day. I do have some updated numbers that I think I'll be getting. I usually get some pretty routinely, so I can get those to the committee as soon as I have them.
Okay, great, thank you. Then I guess beyond that, have any FEMA reimbursement requests for mass care been rejected? Or I think there's sort of, outside of rejection, there's one other category, I don't remember, basically where they want more information, not necessarily approved, but it's sort of in this limbo area. Do we know if any of those requests specifically for mass care are in those latter categories?
The latter categories being either rejected or requests for more information?
Yeah.
I have not been made aware of any that are rejected as of yet. I do know there are a number of items that they are looking for more information on. But I can, again, with your FEMA update, it sounds to me like you're asking for specifically flag any rejected claims, so you know that those have happened. And then, I mean, we may have literally hundreds of claims that they're asking for more information on. So I don't see myself going through to itemize each one of those, but I will see on a percentage basis how many of those are coming back. And then also, as we get money in, I think that might be a helpful thing to add to that report. Does that sound amenable?
Absolutely. Yeah. Thank you, Mr. Vosky.
Okay.
All right. Then I guess my last question on this topic before I open it up to folks in the queue. Part of, and there's been some written correspondence between myself and the administration on this topic already. So part of the issue with FEMA reimbursement for mass care, as I understand it, has been this data cleanup project, which, if I remember correctly, from October of last year onward to now, we're good with our data, but there's a project that I'm curious, is it ongoing? Are we done with the project? What's the status of it from October of last year prior to that? Is there an update on that?
No, there's no update at this time.
Okay, thank you. All right, so I'll go ahead and pause and see if other members want to get in the queue. All right, not seeing anyone, then we'll go ahead and move on to the next topic. So next topic on the agenda is the winter family overflow and winter policy. So I added this topic after understanding that there have been several instances in the community over the last few weeks where winter family overflow was stressed to the extreme. So I'd like to start this by turning to the Anchorage Coalition to End Homelessness to first give us their sort of normal monthly updates, as well as walk through some of the information that they have put together on this topic and some possible ideas or solutions that they have. And then after the coalition, I understand that we may have some folks from the school district or Christian Health Associates that might be able to add on this topic as well. So we'll start with the coalition, and then we will go to ASD and Christian Health Associates if they are available. Then we will go through the queue. So turn it over to the coalition.
Thank you, Assemblyman Felix. This is Taria with the coalition. I do have our regular presentation. If you're okay, if we start with that and then move into family at the end.
Absolutely.
Marvelous. For some reason, I cannot share my screen. Does someone else want to share the presentation?
Kiana, if you have it, could you share it? Otherwise, if you could give Taria access, that'd be great.
Oh, awesome. Thank you so much. I do have access now. Okay, thank you so much. So for our normal presentation here, we are talking about the Housing Surge and Shelter Stabilization Initiative, where our focus, as we'll just keep repeating it, especially since we did not get to report to you in December, our focus is on individuals over the age of 25 with no children in physical custody, i.e. single adults. And our intent is to reduce the shelter demand and increase housing. We did include this slide this time about the HUD designated continuum of care, as the Anchorage Coalition to End Homelessness is Anchorage's designated HUD continuum of care. Just to go a little bit further, and I hate reading from slides because you can all read, but I'll just sum it up, that the coalition is here to help organize and deliver housing and services to meet the specific needs of people experiencing homelessness as they move to stable housing and maximize self-sufficiency. This usually and should include an action plan to address homelessness and prevent a return of homelessness. HUD states there's 4 parts, and I'm not going to go in depth, but briefly, it's outreach, intake, and assessment, emergency shelter, transitional housing, and permanent supportive housing. When I was looking at this slide, I really wanted to talk about how we, our partners in our community, we are already doing this. And so that makes me really happy that we are on the path, but today's presentation is going to tell you that we do need more. As required with our contract, bringing you the data, and of course, I will remind you that I love data, so I'm happy to bring this to you. I do have an update as the meeting was postponed from last week. I did not have the numbers for December, but I do now. And so that number for the first line of total adults over the age of 25 experiencing homelessness in need of housing and support. That number for December would be 2,078. Just a reminder, these are folks that were touched by the system, not necessarily in shelter. Also, to go down the line, the 140, those that kind of been reached by street outreach. As you can see, that is a significant decrease, but that decrease happened because there was a lot of COVID exposures, staff shortages, of course, a holiday. And if you're not in the know, we are currently participating in the pick count right now this week. So we are hoping next month to come to you with higher numbers in this section. And then lastly, a success, in my opinion, is that we have increased the total number of folks housed in December to 25. The Landlord Housing Partnership, which I will talk about later with United Way, has been conducting weekly meetings with Catholic Social Services, ICM team, and Intensive Case Management team. I know all of the acronyms. I'm not sure if everyone does, so excuse me as I slow down for everybody else. But they have been meeting weekly, and that has actually really been helpful to matching landlords with those that are experiencing homelessness. And I will speak more on that program later on. Of course, if you want to see the data and play by yourself, the website is on the bottom of this slide. This is our current shelter capacity for single adults. This is how we know it as of today. I really like the snapshot. What is the coalition prioritizing? So these are the things that we are prioritizing right now. There's a lot of things on this list. Briefly, we are participating in the facilitation group. We are designing and implementing the sockeye, implementing the Barrett, of course, working with the Landlord Housing Partnership with United Way, partnering with the experts at the ADRC, which is the Anchorage Disability Resource Center, to assist those that might need personal care services or assisted living home, deploying AHFC's EHV vouchers, which is emergency housing vouchers that are good for 9 years. That's a very long time for housing stability, designing the rental and housing stability program for AHFC to administer, leveraging all the HUD, state, and municipal and philanthropic dollars that we can, focusing on coordinated entry for that prioritization to placement for those that have been in homelessness the longest, so our chronic homeless folks, and supporting our ongoing and future permanent supportive housing projects. But of course, my favorite, ensuring data completeness. If you don't know anything by the time I leave here, is that I like data. We have the same bottlenecks and challenges. We do have a new one, and that is just working with HD to identify resources that can be leveraged to support the facilitated exit strategy. So that's HUD funding, alcohol tax, HD operating dollars. This is an ongoing conversation that we are happy to continue with AHD, and we are looking forward to meetings to make sure that next month we can bring to you some of those HUD funding or those funding streams that we can leverage. Again, the same bottlenecks and challenges that we've had before. One of the new ones here that I thought was interesting is that some of the assisted living homes are not accepting clients without approved Medicaid waivers. So that is a stumbling block for us. But again, our help and experts at ADRC are really helping us navigate that situation also. This slide is just simply a reminder of our gaps analysis, which was pre-COVID, but the solution to homelessness is housing. And we're just going to keep saying that over and over as the coalition. A lot of folks ask me, well, what kind of funding is there for rental assistance? And I really like this slide because it tells you how much money we really have in our community, and that the funding for rental assistance is not the issue, it is the lack of available units. I spoke briefly before about the United Way Landlord Housing Partnership, who's doing amazing work. They're actually doing weekly Zoom meetings to inform landlords of this program. They're doing another one today at 12 o'clock and every Wednesday at 12. I will put in the chat later how to reach them, but it's landlordhousingpartnership@gmail.com. As you can see in bold on this slide, they have increased their incentives, and I did a little snafu. I reversed the amount, so really it's $1,000 at lease up, and then $500 for tenant retention. And then if someone has a past sexual offense or past drug related offense, landlords can actually receive $1,500 at lease up, and then $1,000 at 6 months for tenant retention. United Way is definitely wanting to ensure that folks remain stably housed. And so increasing this incentive we're hoping will impact those that are experiencing homelessness. And then they also increased their risk mitigation fund to $2,500 maximum. These incentive payments can also be in addition to other funding streams. So like if someone has an emergency housing voucher, they can also tap into the rental incentives, which should hopefully increase them to be successfully housed. So we're hoping to layer. This slide is a more thorough look at the sockeye. I know there's been a lot of conversation. There has been 150 or more individuals identified needing this shelter. And so it coming online where they have a choice to stay there, where they can be in a placement for 6 to 18 months, get the care that they need, those personal care attendant services, where they can have the ongoing case management and work on permanent living situations is going to be enormous for our community. Also work on going to assisted living homes if that's exactly what they want to do. This program is underway, being designed with our partnership with Catholic Social Services, Agnew Beck, Rasmussen, the Alaska Mental Health Trust Authority. Not sure, and as I was doing the slides, I was like, Sala Remote Medics has been doing an amazing job, and it ties into the sockeye of showing the need in our community for the shelter like the sockeye, which will be the sockeye. So Sala, this is a snapshot of the day. They're currently providing services at the Aviator, the Alex, and the Gas House. In one day, I just picked a random day, they had 346 residents that were screened, including going door to door at those locations. Of those 346 folks, there were 5 folks that were assisted in non-emergent transport to the hospital. Their services include responding to incidents like shortness of breath, care coordination, wound care. They pick up medications. They provide medical equipment such as wheelchairs and crutches. These are people experiencing homelessness that might not be able to go to the doctor, don't have a primary care physician, have apprehensions about getting medical care, because Sala has built those relationships, has been on the ground every single day. Again, if you're looking at the number of 346 and realizing the sockeye is only going to house the 150, then truly this is a reality that there is a need for more services like this in our community, but that the sockeye is a great start. The other thing is if Sala didn't do this work, that our hospitals would be more taxed to fill this gap. So this is really a slide of a kudos for Sala and their wonderful assistance in our shelter system. These squares here are what ACH envisions after the mass care closure. So this is the housing and shelter navigation and residential treatment that we believe should be online, hopefully in June. And as a reminder that this mass care exit strategy implementation plan implementation strategy, it is not an alteration to our homeless prevention response system or the community's plan. This is a way to expand and use all of our many resources at this time to make sure persons experiencing homelessness are connected to services and become housed. We cannot do this work without you. If you've heard me speak before, I really like the domino effect. I like playing dominoes in my off time. And so without each person that does to engage, respond, partner, interact, reciprocate, we cannot continue. The next domino does not fall. So we understand this. We look forward to partnering with any and everyone, and hopefully more to come on that. Assemblyman Felix, that is my presentation from the coalition on the housing surge. If I can move right into family shelter, or do you want me to wait?
Let's actually do a quick pause,
Thank
see
you.
if there are any folks in the queue for the update, and then we will move on to the family shelter issue. So I'll go ahead and start with Mr. Weddleton.
Well, thanks. Yeah, appreciate all that information. It was really helpful. So I got a couple questions. Who pays for SALA? And then a second question is, we're moving fairly rapidly with the sockeye and Barrett Inn and the Salvation Army facility. I think I'm just moving along. But, are people? So we have this facility, but the people operating them, are they ready? What's the status there? Two questions for you.
Wonderful. So for SALA, that contract is signed with AHD. So they're getting funding through an AHD funding stream. And then as far as is the provider or the operator of the sockeye ready, is that the question?
Well, just broadly, so we've been kind of focusing on the facility, but that's just an empty shell unless there's people there to run it. And I just, I went to a meeting last week that was kind of a broad discussion of where are people at, but it was so rudimentary, which is a good meeting. I'm glad it happened, but it was very rudimentary. And I want to know, we will need people and organizations ready to roll pretty soon.
Yes, definitely. And you will be happy to know that with Agnew Beck, there is actually a implementation plan already it's actually drafted. So it's still in a draft phase, but it is being created. The providers are being contacted. And if I believe I'm correct to say that there's weekly meetings, if not bi-weekly meetings. I do know that at the coalition, we do have Dakota, who is in on every meeting because that more connects with the healthcare and homelessness section than my section on the housing surge. But definitely prepared to bring more information for our next report.
Good. Thank you.
Thank you, Mr. Weddleton. Mr. Constant?
Thank you. Hi there, Trey. Can we go back to the slide that demonstrated the various places in the plan for after mass care?
Sorry, I realized I was muted. 1 second. Yes, sir. Certainly. Is this the slide, Assemblyman Constant?
It says end of slideshow. Click to exit.
Okay, hold on. So interesting. Okay, how about that?
That's it. So,
Okay.
and you moved. So
There we
go
go.
back. There you are. Go there. Okay, so I'm hopeful you will be able to share this with the facilitation group because this is the most crisp demonstration that I have yet seen about the plan after mass care. And so I'm really grateful for this slide. You went through it really quickly, but it does do a really, really precise job of demonstrating all of the parts in one place. And so I am hopeful that we can broadly communicate this, recognizing that they're moving parts. You might put another, I guess, RFP still to be issued over there intimates it that these are moving targets, not permanent fixtures, but this is very exceptional demonstration of what we've been talking about. Thank you.
Assemblymember Constant, this is Meg Zalatel, Interim Executive Director of the Coalition, for the record. This slide actually needs a little bit of updating. You'll notice it's missing the special populations plank of the plan and a few others, but be happy to provide the updated slide and noting that some of these projects are still to be brought on, and it is also missing an additional asset being brought on by the Salvation Army. I think what this slide reflects is not only potential expansion in the homeless prevention response system through the mass care exit, but for direct investment from that strategy, but additional investments being made by community providers such as the Salvation Army. There'll be 45 additional beds brought online as we move through mass care exit from the Salvation Army, in addition to what the and in addition to their treatment beds, So we've got 45 expended capacity plus what Mass Care is bringing on. So it's really dynamic in that we're seeing additional investments outside of the Mass Care exit strategy being made because investments are being made by the municipality and the partners.
Absolutely. I mean, even just the one center box there, they are bringing on another 20 or so apartments, and there's a lot additional to this. So it's good to have those in some other framework, but putting this in this way really helps to communicate the big picture. So I'm very, again, grateful because this is the first time I've seen it in a way that can clearly communicate. Again, recognizing that some of these parts are moving, some of them are on the deck to be implemented, some of them are still in the dream phase, but it's good. Thank you.
Thank you, Mr. Constant. So I'm next in the queue, but before I get to my comments, questions, and actually, if you could bring that slide back up, my question was for that same slide. I just wanted to note for members of the public who are following along, so you can find all of the documents for this committee meeting at the Assembly's website, muni.org/assembly. Go to our committee page and go to the Committee on Housing and Homelessness page. You will see that there are a few items there, the agenda, and then this particular presentation is on the website as well. It's the Assembly 01.19.2022 final. That is this document that we are going over. And then there's also a implementation update for the facilitated plan, which we will go over later in our agenda, just for members of the public trying to follow along. So I had a couple questions on here. So first, and I think Ms. Zolotel addressed it a little bit. So it sounds like 48 of those 68 beds for substance misuse treatment are Salvation Army. Do we have any idea of what's going to meet the delta of that? That's first question. Second question is, so the beds for Brother Francis and for Downtown Hope, I forget Hope Center where they were at prior to COVID, if this is still their COVID numbers or what. But do we have any idea of, are those the final numbers that those organizations have settled on, or are those sort of adjusting and influx numbers?
Thank you, Mr. Rivera. So the Brother Francis number is still one to be refined. It's asterisked as an estimated number. Right now, Brother Francis Shelter has basically the complex care individuals that we hope to see either get into housing or move toward care at the sockeye. And as they are able to reduce that particular population census, they'll recalibrate their operations. With regard to Downtown Hope Center, they've remained pretty steady throughout COVID. This is pretty much in line with their prior census. And this is the current census that they've reflected on the dashboard. So I wouldn't expect considerable change there. With regard to Salvation Army, let me clarify. There's actually 3 lanes of work Salvation Army is involved in. It's bringing on the Booth House, which will be 30 veterans, and that is not on this particular slide. It's an update after we provided it. And then the McKinnell House, which is 15 units for women. And then in addition, that also has the 68 beds for treatment, and that was the project where the $100,000 from the Assembly helped aid in its design, and then there's state funding to help them bring back that treatment facility on I believe it's 48th Street.
Great, thank you for that clarification, Ms. Zolotel. All right, next in the queue, I have Ms. Allard.
Thank you, Mr. Rivera. I just wanted to be on record of stating that Ms. Zolotel's participation as acting director of the ACH, I believe, is a conflict of interest. I'm not quite sure how any of us believe that this could be a separation between assembly person and the director, acting director, or temporary director. I just want that on record. I'll be following up with this with the legal department. Thank you.
Thank you, Ms. Allard. I will just say for my part, I made it very clear at the beginning of the meeting that Ms. Zolotel was here in her role as the interim executive director. And we absolutely need the Anchorage Coalition to End Homelessness to be a part of this meeting and to be involved. And so I appreciate them having multiple staff here to be involved in this discussion. Mr. Constant?
Yeah, and I don't believe any action is being taken at this time, but I would offer that a member can at any time an action is before us make a position known that an item is in conflict and the members are the judge of that question.
Thank you, Mr. Constant. Mr. Gates?
Oh, thank you, Mr. Chair. I was going to mention similar to Mr. Constant. It does not appear there's any action being taken. If there were, Zolotel probably couldn't participate in action, you know. But I would also say that I'm aware that there was some, I guess, advice from city ethics officer to Ms. Zolotel, and she's in compliance with that as far as I can tell.
Thank you, Mr. Gates. All right, I don't see anyone else in the queue for this, for the ACH update. So we'll go ahead and move on to the winter family overflow issue. We'll go ahead and start with ACEH, and then we'll move on to ASD and Christian Health Associates.
Wonderful. Thank you so much again. And also just to that last slide, we are gauging the community in other ways to see if there's something we're missing. So I think as we come to present to this assembly, you will see a dynamic change, and we'll make sure there are more little boxes so that way everybody understands the full picture of what's happening in our community as it is fluid at this moment in a great way. So going on to family shelter, we really wanted to come to this committee to point out the continued uncertainty that we have around that there's not a clear plan for family emergency weather shelter. For the past couple of weeks, we have had 2 occasions where on weekends we're scrambling and trying to help each other out and figuring out how to place families, where are they going, having issues with identifying who is the family. And it's really hard on our partners to be able to provide accurate information to clients in need, but also on our partners to be able to act and ensure that that person is not waiting 24 hours or 48 hours to be housed, that we are truly meeting them in the need as we used to. I do know that on the coalition standpoint, we have sent a memo over to address this, and we are looking for any solutions at this time. I will yield the floor to either Dave Myokile or Dave Kuiper, who has been in this fight with family shelter for a long time.
Great, thank you. So would either Mr. Myokile or Mr. Kuiper like to add to this discussion?
Hi, this is Dave Myokile from the school district. And I just going to echo Taria's concerns in that we have had, a meeting with Rob C. and his team, and we've had assurances that there are motel rooms available on a nightly basis for families. But there have been a couple of times when we've also gotten emails on weekends that there's no place to place a family. And so we've had to kind of scramble to figure those things out. And I just would like some clarity to make sure that there are rooms available on every night for families that need shelter. Thank you.
So this is Dave Kuiper with Christian Health Associates. Thanks for looking at this as a topic to discuss of great importance. The coalition has been working really diligently with a number of folks that have over the years worked really hard to ensure that no family is faced with sleeping in an unsafe place, particularly in the winter. And so what we're really hoping for is that there may be some resource that is provided, hotel rooms, whatever, that we can be assured that families will be able to be resourced and then followed up with to help them find more permanent housing solutions, but also the resources, supports that they need. So, so thanks for giving attention to this in this meeting. We hope that bringing it forward can lead to a really solid solution going forward. Thank you.
Great, thank you. So I just want to summarize what I think I heard. So from both ACEH, ASD, and Christian Health Associates, from all three. So the clarity that you're seeking from the municipality is on hotel rooms. Are they available? How folks can quickly access them if something happens, and we have a family that is that needs some place to stay. And then also sort of what are the resources and supports that so folks can get out of homelessness for families. Is that an accurate representation of the issue here? I just want to be clear of what we are talking about.
This is Taria with ACH. I believe that is accurate. And then just in addition, making sure that there is a known process and that it is implemented and that we're continuing in that plan moving forward to the end of family shelter. I think that is the piece that's missing there, is the known process.
This is Dave Kuiper. I just want to add to Tiara's statement there. I don't think that the folks that have been working toward a solution are looking to the municipality to provide a solution on their own, but in consultation with this group that has been working really hard and does have some historical experience with the family needs. And so it would be really helpful to be joined in this conversation with the goal of establishing the process that Tiara stated. Thank you.
Okay, so then I will go ahead and just restate this one more time. Thanks for providing that clarity. And then I guess I'll just turn it over to the administration to see if they have any thoughts on this discussion before moving on to see if folks have any questions or thoughts in the queue. So as I'm understanding, just to recap this conversation, there is a request to have clarity on the hotel rooms available, accessing those rooms, what is the process, making sure that is known among the different providers and that process is being implemented. Just a general desire to make sure that we have resources and supports needed, specifically to address homelessness with regards to families. And then a desire to work for the municipality to work in consultation with the groups that are working on these issues. And I assume that means there are sort of regular coordination meetings that are occurring, and the municipality's presence at those coordination meetings would be helpful. That's what I'm assuming that means. So I guess I'll just turn it over to the administration just to see if they have any sort of initial thoughts based off of the conversation thus far.
Thank you, Mr. Rivera. This is Amy Domboski again, Municipal Manager. I spoke with the Health Director this morning, and he did say that there are rooms available at 3 of the different locations that the municipality is currently contracting with for family sheltering. So as of this morning, there were rooms available. I'll be happy to ask the Health Department to articulate the process in accessing those and making sure that we are distributing that information so people know how to access those resources.
Great, thank you, Ms. Domboski. Okay, so I guess with that, I'll go ahead and open it up to the queue, see if anyone has any questions on this topic. All right, I'm not seeing anyone. I'll go ahead and pop in with what's probably a basic question that I should know the answer to. So, as I understand it, due to COVID-19, part of the reason why we needed to get these hotel rooms and other resources in place is because the churches, which used to provide this resources to the community, which speaking for myself, very thankful for, stopped providing this resource. I guess, and I think perhaps Mr. Kuiper might best be able to address this. What is the plan, sort of long-term plan, I guess, going forward with regard to that church network that we had, being able to provide this resource again?
Thank you, Mr. Rivera. This is Mr. Kuiper. So the churches were glad to provide emergency cold weather shelter for about 10 years until that system was interrupted by COVID-19 and the health risks associated with it. And it had been set up to come alongside the shelters, the family shelters that already existed through Salvation Army and Catholic Social Services, to provide a place to go if the other shelters were full. And it was a great system, and it did provide an assurance that there would always be a place for a family to find shelter. One of the things that we noticed over time is that while it was an emergency shelter system that provided safety, it also required that a family with children pick up their things every morning and move out of a church facility, because of other programming that went on, and then resettle in a different church that signed up to take the next night. So it never really provided a very easy system for the families to settle and then connect with resources beyond the church shelters. So whether the churches, I believe, would be prepared to re-establish the system that was in place. However, the church coordinators and their volunteers have expressed to me that uneasiness about the families having to move night to night to night. And so something more permanent, where a family could settle into a hotel for a few days while they were resourced and helped to find better housing solutions. That's actually more desirable than to move from one place to another on a daily basis. So, short answer, I think the churches would be willing to stand up the system once again, but I don't think we would find agreement among all the church providers that that's the best system to stand up once again. Does that make sense?
That does make sense, and thank you for walking through the intricacies there. Very curious to see if this makes sense, if there's any willingness to explore this. I myself am not necessarily married to the path forward. I just know, it's something that for, like you stated, for a decade, something that something reliable that the community had. But if there's something different that we should do that's better and that helps people, then I think that's great. Okay, so then my next question, I guess, would be to Ms. Ware. So I know this is probably a difficult one to answer because, as I understand it, these are mainly sort of emergency kind of situations where, folks sort of all of a sudden lose their housing and they need assistance, and we're sort of scrambling. But is there sort of any idea that you have of the scope of the problem? Are we talking about, every week we're dealing with this issue? Are we talking about sort of this is a isolated incidents? If you could delve into that a little bit. Thanks.
Yes, wonderful. And so, to answer, you're talking about families, correct?
Correct.
Yes. So without the data from Awake, and I don't know if they're on the call, but I would go further to say that at least every day there is a call for a family in need of a shelter opportunity. And so at some point, especially on weekends, it seems to be the most difficult to place them. Before, and I was a part of the wonderful shelter system as a volunteer before and really appreciated that. But Dave was correct. It was very taxing on our families to go to a different church every night and then pack up and leave and go to the next place. But so this is something that we can bring the data on as far as like how many calls are coming in. It also includes transportation. Some of our families, most of our families do not have cars. And so Awake is providing that transportation in collaboration with the coalition for cab vouchers to get to those places and get from those places. I would say the need during the cold winter months is the highest. And during the summer, we don't see that need as much, which is why I believe for the emergency family weather shelter, it is mostly the from September to about April or May where we are seeing that need.
Great, thank you. Mr. Kuiper?
Thanks, Felix. So we do have some historical data from the churches that shows that in the winter months, there have been as many as 900 to 1,500 shelter bed nights provided in churches with the help of church volunteers. So that gives you some idea of the scope of the need. Does that help?
That does help. Thank you.
Okay.
All right. So,
and I think currently right now there are 12 families between the guest house and the aviator, and that does not include families that are at the sockeye, and that's as of this morning.
Okay, great. Thank you for that addition. All right. So I did want to delve a little bit into a policy discussion regarding the emergency shelter plan for homeless persons, which is Anchorage Municipal Code 16.120. What I think I'll do is I'll just sort of introduce this topic now, ask my questions to the administration, and then we can go ahead and delve into this next month more concretely with hopefully some responses from the administration at that point. Just looking at the time, I want to make sure we have plenty of time for our other agenda topics. So, I don't know exactly how related these two things are. I think there's probably some amount of overlap, but we have a section in our code, like I stated, 16.120, that deals with the emergency shelter plan for homeless persons. And it's the plan that's basically activated during the winter. And, one of the concerns I've heard for years from folks is about timely implementation of the plan. Based on what I hear in the community, we never seem to be just ready when it's time to actually sort of implement and get things done for winter. We always seem to be a little bit behind the 8 ball. So, I'm just wondering if the administration, and again, this is just to put it on the record, and then we can delve into this next month, might be able to just comment on this or offer any thoughts that they have on whether sort of this code section is doing what we want it to, and if perhaps we need to sort of add some guidelines or guardrails to ensure that sort of we are adequately prepared for winter every year. And if that kind of exploration is helpful, or sort of what are the levers that we can push as policymakers to assist in that. So again, just wanted to put that on the record. We'll talk about that more next month. So I'll just pause really briefly before I move on to the next topic, see if anyone else wants to get in the queue. Okay, not seeing anyone. So we're going to go ahead and move on to the 2022 goals. Thank you, Ms. Ware, Mr. Kuiper, and Mr. Mayo Kiley for your participation in that. That was, I think, informative, and hopefully the administration, it sounds like they will be getting some more information to you. So hopefully that will assist with the issues that you outlined. Okay, so moving on, next we have the 2022 goals. So this committee had, I think, a brief discussion on 2022 goals in December, but I wanted to sort of bring that back again to this committee, and sort of given the example that several of us went through in the Community and Economic Development Committee, where Ms. Allard and Mr. Weddleton sort of led the charge for developing their rather lengthy list of items to delve into in 2022. I wanted to see if go through that exercise one more time in this committee using the template provided by Claire Ross at the last Rules Committee meeting. And so I'm going to go ahead and share my screen. We'll go through this exercise. And then I want to make sure we have plenty of time to do an update on the facilitated process, which is a standing item that we've agreed to have on our agenda, as well as time for the legislative priorities and the final audience participation before we adjourn. So with that, let me go ahead and just move things over to share my screen. Okay, so folks should be able to see my screen. Now, I will say I am not able to access the queue because my screen is being shared. So I will ask someone else to do that, to help me with the queue. And I guess I'll go ahead and ask the committee vice chair, Mr. Constant, if you could do that. So I don't know if folks got a chance to look at what Claire Ross put together, but basically what Claire put together a sort of a work plan for committees that would be something that the committees look at sort of at every meeting, just to do a check-in on where we are with these different items. And the way that Claire organized this document, and we can shift this for our usage, was priority areas. If there are sort of any annual tasks that we do sort of every year, to make sure that those are calendared, talk about any potential future projects, and then any deferred things, projects or items that maybe have been talked about in previous years or previous committee meetings that we want to maybe go back and talk about that again. So I'm going to go ahead and just start with 3 items. Oh. Sorry, who was that?
I put myself in the queue as well, so you go ahead and then I'll go after you.
Okay, great. So I'm going to start with 3 items to add onto the priority areas, and then we'll see what folks have in the queue. All right, so first I have is keeping track of FEMA reimbursement for mass care. That is a priority I'd like to see this committee focus on this year. Second is housing, and I'll just leave it general like that. Every single time that the Anchorage Coalition to End Homelessness does their update, just like they did today. And every month, there's always talk about the need for more units. If we only had more units in our community, we'd be able to house more people. It's not that we don't have the resources to house more people, it's just we don't have the units. So, that's a priority item for me. And as folks saw on the agenda, I was hoping to start that discussion with an overview of housing opportunities, but that's going to be in February. And then the last one is I don't know exactly how to frame it, but as has been discussed by folks in the facilitated process, finer point, the assembly members in the facilitated process, there is eventually going to be a transition. When does that happen? I don't know. What does that transition look like? I don't know. But eventually, there will be some type of assembly oversight of things going on that have been triggered due to the facilitated process. And so that is one of the things I want to keep my eye on as for this committee is sort of oversight of facilitated process. I'll just call them items for lack of a better term. So those are the three sort of off the top of my head items I wanted to make sure were included. That is it for me for now. So we can go ahead and go through the queue.
All right, and for mine, it's under the annual tasks, just based on what you previously discussed. We should have a early summer planning process for winter shelter plans, and then we should have a late winter process for debriefing the last year's summer plans for improvements. And next in the queue, and just for the record, Ms. Domboski is left. I have Ms. Kennedy, then Ms. LaFrance, then Mr. Weddleton in the queue.
All right, thank you, Mr. Chair. I don't know for sure if we can do this, so it actually comes down to a question first. But I have always been interested in just the ability to better track the funds that come in and out of the municipality for homelessness. A lot of times we try to get a number, how much are we spending? So if there would be some kind of budget tracking capability where we could look at exactly what the muni is expending out of general funds, as well as accounting for whatever grants just basically go through the muni accounting mechanisms or processes. So that at any given time, we can have more of a sense of what the muni is really doing to put funds into the community. And it wouldn't have to be a monthly report. I wouldn't expect that. But if we could do something quarterly or even 3 times a year, I think would help give us a, more of a sense of, kind of what money taxpayers are putting into this and what money the community has been putting into this, or maybe state sources or federal sources, I think would help us all have a little bit more of a grasp on a regular basis of how much money is actually going into homelessness. So anyway, and I think it would be a question to the administration to see if that's actually possible to track something that specific amongst a variety of different sources. But anyway, thank you.
Thank you.
Should I
Who's
just
next?
go? Oh,
yeah, sorry, go ahead.
Thank you, Mr. Chair. And this is also maybe a question concerning communications. And when we go to community council meetings, homelessness is pretty much at the top in terms of what's being done, what is the Assembly's role, or how does it fit with what the Assembly is doing, with what the administration is doing, and how to make sense of the data, where to find data. So I'm not sure specifically if this would be added or how it would be. Okay, I see you added communications for homelessness. Perfect. Thank you. That's all I wanted to bring up.
Thank you. All right, who's next in the queue?
Is Mr. Weddleton.
Oh, thanks. a couple points. I think they fit here. One is shelter licensing. We have that ordinance out there, but the specifics are still fairly vague. And then part of the shelters in allowing them in B3 included sort of what we call a no tolerance zone. And that needs to be better defined and make sure we know the legal parameters of that. And then another thing that I've been thinking about, and I think of it as rehab from free federal funds. We do, citywide now for mass care, some pretty high level, not just the sheltering, but like with discussion of SALA and so on. And none of that comes free. It's really expensive, and it's, I assume it's needed and done well, which is important, but what are we going to do later, when that all ends? And I think that ties to what Crystal is saying. We don't really have a really, clear one place to go where we see what's being spent where. So we don't know. We set expectations, very high expectations, on what would be provided, and we need to look at that and say, well, what can we truly maintain? And that'll be a challenge, to find the money and really do that. I think that's the main thing. I mean, some is to define our role, in the homelessness, and I know the anchored home kind of current retired version and the upcoming will do that, but it needs to be fairly specific. I think, we've really dove in at a much deeper level than we had before, and I think that's appropriate, but it needs to be some parameters on it too, because it's one of those problems that has almost unlimited needs, and we obviously have limited resources. That'll take you 3 years to solve, so put that wherever on the list that would go. Thanks.
Felix, I don't see anyone else in the queue.
Okay, great. Thank you.
Could you scroll back up real quick? Sorry. Okay, never mind. Thank you. You have what I need.
Thanks. All right, so thank you for this. I guess I'll just pause one more time, see if folks have anything else they'd like to add. I might do a little bit of fleshing out with regard to some of the annual tasks. I might just go through past agenda items, agendas from the committee over the years to see if there are any sort of specific things that we just want to make sure we have calendared. And I'll think about future projects, deferred projects. I'm not sure if we necessarily have anything in that arena. But I'll just pause, see if there's anything.
I have one more to add then to the calendar. It's the legislative cycle. Be prepared for legislative appropriation requests. Possibly make reports to the legislature. You could also add review anchored home or coalition coordinated plan annually.
Great, thank you. Good additions. All right, so not hearing anyone else, then is there any thoughts on ranking for these items? Otherwise, what I will probably do is just rank them based on my sense of things. And I might need to get further clarity on some of these items just to make sure, as I develop future agendas, that I am doing what you all hoped on these various items.
I think Mr. Chair, what we recommended the last time we did this in CEDC was the chair make a recommended ranking and then bring it back, and the conversation goes from there.
Got it. I will do that, and I'll bring this back for February. Okay, with that, I'll go ahead and stop sharing. All right, so let me go ahead and just look at our agenda. Okay, so that completes our business items. So we'll go ahead and move on to committee legislative and budget priority items. First is the facilitated collaborative process between administration and a legislative drafting group. Who would like to do updates on that? Don't everyone unmute yourselves at once. All right, I guess hearing crickets. So for folks, members of the public and of, oh, okay. No, that's from earlier. So for members of the public, just an FYI, on the committee website, there is an implementation update. Usually we get them Monday or Tuesday, and I try to make sure that we get these posted on the website. So the last one on the website is for the 18th. So I don't know if we got one, if we've gotten one since the 18th, but I'm not seeing it on the website. Can someone from the facilitated process clarify, have we gotten an update since the 18th?
I think one was prepared. I don't, and yeah, maybe it wasn't sent out. That's a good question. Yeah, we'll check. We're meeting at 1, so we'll check then and get that version out. It usually takes a couple of days where Belinda writes it up and then it goes around us and we edit and then it's prepared. And it could be that step got missed. Sorry about that.
Okay, no problem at all. All right, so then I guess we'll look forward to that. And like I said, I'll make sure we get those updates on the committee website so folks can, members of the public and the body and the committee can keep up to date with that. Okay, so then I'll go ahead and move on. Are there any legislative or budget priorities folks want to discuss? Okay, then we'll go ahead and move on to final audience participation. So for members of the public, thank you for joining the meeting. We have probably about a little over 10 minutes for final audience participation. So that'll be 3 or 4 individuals if you use up all of your 3 minutes. If you could give us your name, please, and I will go ahead and do a timer for 3 minutes. If you're on the phone, it is *6 to unmute yourself. So I'll go ahead and open it up and invite any members of the public who would like to participate. Ms. Dembowski?
Yes, Mr. Rivera, I hung on because I was hoping my comments in the chat would be shared and they were not. So I just stuck it out. And I'll be late for my next meeting, but I just wanted to re-invite all assembly members who may have questions to forward your questions directly to me, and I'd be happy to get those answers for you. I just want to remind folks that we're happy to give you the information that you're seeking. We just need to know what your questions are so we can adequately answer them. Thank you.
Great, thank you, Ms. Dembowski. Apologize for not reading that into the record. Okay, so going back, again, if there are any members of the public who would like to participate, now is your opportunity. It is *6 to unmute. So I'll go ahead and just wait a second, see if anyone would like to participate.
Yeah, this is Julie Coulomb. Can you hear me?
Yes, we can. Go ahead, Julie, you'll have 3 minutes.
Hi, so my name is Julie Coulomb. I've been recently appointed to the HAN Commission. My comments were directed toward the Landlord Housing Partnership, and I feel like the HAN Commission could probably partner or support this program. I wanted to just give a viewpoint from a landlord. I am a landlord. I'm interested in why there is hesitancy for landlords to participate. I appreciate the money incentives, especially the cleanup costs, move out costs that are being offered. But it's difficult. It was concerning because in the ACH presentation, she had mentioned that there was additional money for people willing to house people with on the sex offender list. So as a landlord, I'm also responsible for the people in the other tenants in the building. And so I can't speak for all landlords, but as I look at it, I have to do what's right for the rest of the tenants as well. And I did house someone with addiction history, and it did not turn out well. There was the police coming to the condo. There was a lot of noise, and they actually left the place just destroyed. We had to totally clean it up. So I don't know what the parameters for that is as far as landlord protection. I would love to participate in that, but I'm concerned about what happens in a building if you only have one or two condos or apartments in a building. How does that affect the other tenants? So I'd like to be able to connect with somebody from the United Way. I don't see a point of contact there, and dig into this a little more, and hopefully maybe set some parameters or criteria where landlords would be more willing to participate in the program, because it does sound like there is a lot of funds and not so much opportunity for housing. So just from being able to be on the HAN Commission and having a landlord perspective, I'd like to bring this to the commission and maybe hash this out, see if we can help get this information out to people that would be willing to be part of the partnership. So that's all I had. Thank you.
Great, thank you. And actually, Ms. Toria Ware did share an email that I will go ahead and state into the record. So I would probably just email this group individual, and perhaps they can come to the HAN Commission or set up another meeting. So that email is landlordhousingpartnership@gmail.com. Again, landlordhousingpartnership@gmail.com. And so hopefully that will help you.
Thank you. Appreciate that.
Thank you. Thank you, Ms. Ware. Okay, would any other members of the public like to participate?
Yeah, this is Lindsay Haidu. Can you hear me?
Yes, we can. Welcome. You'll have 3 minutes.
Great, thank you. So my name's Lindsay Haiduk and I live in Spenard, and I just wanted to share some of the how these topics kind of relate to issues going on in our community from the community council perspective. So the council has supported the approach for smaller shelters and services spread throughout town. So we're really excited to see the Assembly and the administration work towards that, including the Barrett Inn, which is located in Spenard. So we've appreciated Mr. Weddleton and the facilitated work groups just updates on that process. And I wanted to just bring another issue that's been a challenge in our community to this committee. We've been working on trying to get a camp abated within our area on private property. And it was something that we started this summer and was very much a challenge. And then the snow fell. And part of the reason I'm bringing it here is because our council submitted a letter to the ombudsman, just really trying to figure out where the breakdowns happened with code enforcement, with APD, with our work with our assembly members, with the administration. And what came back is that the challenge of communication helped delay any process or movement forward from the administration. So I heard Ms. Domboski multiple times say during this meeting that they can answer questions, but part of the communication from different departments through Ms. Domboski or through the administration seemed to delay any action on that property within Spenard. And it's really a disservice to residents and community members who are trying to make sure our neighborhoods are safe, that there are options and solutions for folks who need supports. And just wanted to raise that it's not only a chokehold between the administration and assembly members, but it really impacts residents. And so I hope that we can find some solutions for the community from that. Thank you.
Thank you. I have Mr. Constant in the queue for you.
Thank you. Hey, Lindsay, I am sorry that camp is persisting on that private property. I was working on this last June and July, and I thought it had been taken care of. So I will lift this back up on my list and see what I can find.
Great. Thank you.
Great. Thank you, Mr. Constant. Thank you, Ms. Hajduk. Okay, so then I guess I'll open it up one more time. Are there any other members of the public who would like to participate? If you're on the phone, it's *6 to unmute yourself. Okay, not hearing anyone else, then I'll go ahead and move on. Next, we have committee discussion. Are there any final comments from committee members before we adjourn? I guess one comment that I'd like to, and it's really a question for the administration. I apologize for not getting this while Ms. Domboski was on the line, but I just wanted to get clarity in terms of the sort of leadership chain of command structure in the administration. I have had requests from some members of the public and others about whether we are going to be getting a new homelessness coordinator or whether that is sort of been rolled into Mr. Diamato's portfolio. And I don't think I see anyone from the administration who can address that, but I guess I'll just wanted to get that on the record, and hopefully next month we can get some clarity on that. Any other discussion before we adjourn? Okay, not seeing any. Thanks all for the committee discussion today. I will go ahead and adjourn this meeting.
Thank you.